wanted to wrap up here by having you sit at your tables and think about 3 specific questions. And my 3 specific questions are, how will your county complete the notebook? What other data is available in your county? And how can your county use the notebook once it's complete? Now, we are really out of time. We have about 10 minutes. So I have decided that the one that we will focus on, since it's the most important to me, is how will your county complete the notebook? But I think these 3 questions are all worth writing down in your notes, because these are the kinds of things that you're going to need to talk to your mental health board about. So what I would like you to do, once you've written down these 3 questions, is focus on how will your county complete the notebook? And by that, where I'm going with this is, there are many ways to complete this notebook.
How will they know about it?
Well, they're going to know about it because we're going to send it to them. And you're going to support us as mental health board members. You're going to say, yes, I was at a training about that. And these are the 3 questions we need to think about. Okay? And we'll have instructions with it. We're hoping to get them back by July 31st. I think July has 31 days. July 31st, so that we can write our report. But there are 2 ways we can do this. One is, and I think maybe we'll do this, for about 5 minutes, I want you to talk to the people at your table and say, how will my county, the people that I represent, complete the notebook? So let me give you some ideas of where I'm going with this. Is one person going to sit down and fill out that notebook? Is every mental health client in your county going to sit down and fill out that notebook? You know, so how are you going to do it? I mean, what are some of the things that you need to think about? Are you going to have a subcommittee of your commission, your board? Are you going to have a subcommittee of staff from the mental health unit, department and the board? Are you going to have a couple focus groups to answer some very specific questions? Because there's some questions on there that you could have a focus group around. So glance through this, maybe pick a specific question, and think about what are some of the pluses and minuses, what are some of the things in your county that you would like to think about. And I'll give you about 5 minutes, and then I'm going to walk around and have each table report out just a little bit about what you think some of the issues are and some of the things you'd like to do. So go for it. Okay, so I'm gonna bring the microphone to each table, and I'd like you just to hit on some of the issues that you talked about, some of the things you think you would do, wouldn't do, could do, shouldn't do. So I'm gonna bring it over to the other side, and who wants to go first? I will over there, but I want this table first.
I think one of our challenges that we discussed is who's going to be taking charge and who's going to be, you know, we don't want the mental health director filling this out on his own, which can tend to happen. In one county, someone noted out that there are several questions that can only be for, we're at a rave all of a sudden, that the messages can, the answers can only come from the mental health director in that county. Our county may be a little different. I'm concerned that we have enough time that we do either a study group or special something, but you know, it's going to take work to get the people to take the time to do that. You all know how your boards are about extra time and extra meetings and staying later and all that stuff. So we're going to have to find a way to make sure that they participate and get across how important that this is.
And your other question was, how are the counties that didn't attend?
Oh, yeah, we talked about the other counties that aren't here, that they may have a much harder time.
Actually, for those of you who haven't noticed, we are videoing this presentation, so that would be one way. And then Lassen County already cornered me. That's in the far northern area where I come from. And I told them I'd be happy to come down. I can't come to all the counties that didn't appear. You know, 36 counties, really a little beyond me. But for a few of you who live in the far, far north, if you need some help, You know, I can be on a phone or I can be there in person. You know, so we will work that out. But I think your point is good. Just to re-emphasize that point, one of the things that we want you to do is work the mental health board alongside the staff to come up with answers to questions. One of the questions you might ask is, do we have to answer every single one of those questions? Some of them are more important to us than others. No, you don't have to answer every single one of those questions. If you want to spend a lot of time answering 2, 3, 4, 5, 10 questions, go for it. You know, we'll take whatever we can get.
Okay, this county, this table.
Well, in Merced County, about 2 years ago, we had a training, and the planning council was there, and they did ask about what data is available in your county. And so we provided that to them, so it's not going to be hard for us to put a commission together and ask for that data, obviously updated data. So that's the direction that this table said we would ask for data and possibly create a commission on the board and have them provide that data to us and go from there.
That's great. And so that's a whole nother way is you make a list of the data you need, you work alongside, again, the county mental health staff, but the report comes from the board, and that's really where we want the report to come from.
Her.
What? Oh, did what?
Susan, how's our board going to accomplish it?
Oh, okay.
Debbie actually answered a lot of our questions. Debbie, right here, is with San Bernardino County, and she's part of the staff in here, so that's...
Debbie, you want to make some comments?
Well, we had a data training, a data workshop a couple of years ago, and our county staff provided the data according to the data notebook that was provided to us by the California Mental Health Planning Council. So the county department provided the staff to us to be able to answer these questions, and we had a 3-hour workshop. And the information was presented to us, and we were able to, the board was able to answer the questions.
At this point, most of our board members have been to one or another data presentation workshops, so we're getting more and more sophisticated. I think one of the things that we're concerned about is making sure that we move from process to care outcomes. And we've focused on that. I hope we will focus on that more in the future in these kinds of workshops. But we're in the process also of doing our annual report. And so we will be adding our participation in this activity to our annual report also.
That's just great, and it goes to my third question. How can your county use the notebook once it's complete? And really, I'm hoping that you will present this information to your county board of supervisors, or county board of supervisors, and maybe to one of your MHSA stakeholder groups.
I'm Robbie Powelson, Marin County. I think the way I'm going to go about this is I'm going to make a subcommittee with the board, with my mental health board, and then partner with the quality improvement committee that we have for our mental health plan, and kind of go at it collaboratively and present it to the board of supervisors.
That just sounds great. Sounds perfect. What about right here?
I'd love to give it to the director and just walk away. But that won't do the board any good. It has, it needs to buy into this. My board needs to buy into this in every way. And so I want everyone to participate in the gathering of the data. And some can have individual committees. Some can just answer what they can answer, but everyone needs to fill it in and understand what their commitment is to being on the board. This is what we do, and then we'll compile a common one and send that in.
So one of the things I heard here was it's almost an educational tool also for your board. You know, it gets them to think about certain questions and to think about where do I get the answers for those questions. So it's an educational tool also for your for your folks. Lavinia, did you have a few comments before we go?
I'm going to, for the board people, for my board people, and also for the director. I want him to be a part of it because board members was asking for data and stuff like this here. And so this is good. This is good.
Thank you. So just once again, I think, I know there are more questions that you can talk about when you're working with your board, but the 3 questions I really want to make sure that you get out there are, how will we complete the notebook? What is our plan? You know, it really helps to have some kind of plan. What data is available in my county? And one of the things, and I'll go back to many of the comments that Carol made about the consumer perception survey, you know, how do we implement the consumer perception survey in our county? What does that data specifically look like in our county? Okay, so I mean, that kind of question. And then once we've done all this work, let's do something with it. Let's just not file it away with the planning council. Let's figure out how we can build knowledge in our local neighborhoods about how we want to do this.
Great. So we are wrapping up a little bit early, it looks like. We need you to fill out your evaluation forms. We really read those. We compile the data. You know, now you know why we need the data. We share that with the state when we think of planning for future years, so please complete that. I want to thank all the presenters. Thank you, Cricket, and thank you, Jane, and thank you, Mike, and thank you, Susan, and Linda, and thank you, Brent, the videographer, and Camille for doing the organizational work for today. Yay. Yes, question?
The board members that came to the training, for their mileage reimbursement, are there forms that they need to fill out here? I mean, I'm on the comm board, they're taking care of everything, but for some of our board members that came on their own,
We only were able to do hotel rooms, and that we're not able to do the reimbursement for mileage.
okay.
That's what we said in the announcement for this.
Okay.
That was our compromise for this, to be able to do this. Oh, and yes, thank you, parking. Identify yourself with CiMH, California Institute for Mental Health, or they might say the data training, and your parking will be free. So make sure you do that. That's one thing I can offer you today. Yes, sir.
We've been talking about the services, but we haven't talked about the health providers. There has been a lot of injuries to mental health workers on the units. We haven't addressed that. I work in the field, and we need to find out what kind of legislative bills or something we can talk to, because I know people that got hurt on my unit where I work at, working in mental health, dealing with the people that we working with, and we haven't even addressed that. So I think I just want to know what can we do to address that.
I'm not sure I'm actually going to answer your question, but I am going to remind you that we will have a different data notebook every year. We're not going to ask the same questions year after year. So if you have a topic that you think should be of interest to your board in particular, or boards in general, we'd like to know what kinds of questions you have, so that, I mean, we will not have received all your responses before we start on the next data notebook design. So if there are things that we have really done well, we want to know that. If there are things that we have done not so well and you have some suggestions for improvement, we want to know that. If there are topics of interest, we also want to know that. This is going to be one of those evolving things. We think we've come a really long way since our last workbook, and we don't think we have as far to go with our next, but you have no idea how. I think we pared down from 77 questions or something like that to 18. And so it was a lot of work. And again, I want to thank the CALM board membership for, I think we were at every one of your meetings this past year going over and over and over what we're doing, getting suggestions from you. We had certain folks like Burl and Carrie and Herman were on the phone with us and at our meetings. So thanks to all of you, because this would not have happened without your help. And I have one other person actually to give special thanks to. Now, Linda and I are probably the front end of this. You know, you've seen us a lot. But I tell you what, Jane Adcock, she deserves a hand. You know, she sat there in her office with me, and we went through, and we were brutal. We went, not that question, or reframe this question. And Jane, because she was just a step back from it, you know, sometimes you get so involved in something, and she was a step back from it and could really give us that final piece of input we needed. So I'm going to be around. I know Mike's going to be around. I suspect that Camille's going to be around. Linda's going to be around. I think she's going to be around for a while.
And Cricket.
And Cricket. And I know that Kim has to hop on a plane.
So if you can leave your evaluation forms on the table. And I also want to point out another thing we handed out about the Mental Health Day at the state capitol, which is on May 13th, which is Cal Mesa has been organizing, that if you're in the Sacramento area, we encourage you to advocate. It's a great day. So I just wanted to put a shout out for that. And thank you all very much. It's always a pleasure seeing you all. I know you're volunteers and you're dedicated folks, and we appreciate your time. Happy Easter. Have a great, safe travel home. Thank you. Bye-bye.